Good, happy Friday morning, December 4, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Friday morning, so let's begin. First up, we're going to begin with a look at the weather. And I hear that we could see some weekend snow in New Hampshire. Weekend storm could bring up to 6 inches of snow for parts of the state. With more on that, let's go to meteorologist Mike Haddad with a full weather forecast. Let's go straight to your weather right now before we get to the news.
Chapel Tractor has been in our family since 1955, when great-grandfather Pearlie and our grandfather George decided to sell tractors out of their boat.
Thank you very much for joining us, Stormwatch 9, weather on the web, moving towards another weekend, and this one will feature some nice weather at times, early Saturday, especially in terms of the road conditions, and then a good part of Sunday, although it will be breezy and cold. Squeezed in between all of that, from mid or late morning Saturday through Saturday night to about daybreak on Sunday, a storm likely impacts New Hampshire with rain in the mix, changing to snow, with the heaviest Saturday afternoon and Saturday night, quickly wrapping up during the pre-dawn hours of Sunday morning, so that by daybreak on Sunday, right around 7:15 a.m., all the snow is done, except for snow showers in the mountains. Speaking of snow, where precipitation is mainly all snow, 6 inches plus. Not out of the question. So here is that developing storm. Tomorrow, it's clouds, some breaks of sun, snow showers up north Friday night. Beyond all of this, snow showers north on Sunday, partly sunny elsewhere, breezy and chilly. Monday and Tuesday, quiet, a few flurries on Wednesday. So again, big question on all of this is what happens to this storm during Saturday and Saturday night. Get ahead of it. Fair skies this evening, some clouds overnight tonight. A mostly cloudy Friday, but there'll be some partial sun at times, especially in southern New Hampshire. Then snow showers move in the North Country with a dusting to maybe an inch of White Mountains north during Friday night. Then we jump ahead to what happens on Saturday. Again, we're starting off mild on Friday, so initially precipitation will likely be in the form of light rain or mix. But by midday, 1, 2 o'clock, it's either wet snow or a mix in many spots, quickly changing over to wet snow in all areas north and west of Concord. Eventually a changeover with that mix or rain over to snow at the coast by, say, 5, 6, 7 Saturday evening. All wraps up as snow later on Saturday night. By Sunday morning, the snow is gone, except for lingering snow showers on the light side in northern parts of the state, where it's all snow, over a half a foot, not out of the question. And because the track shift could occur 20 or 30 miles here or there, the amounts of snow are not yet a lock, but they will become a bit more defined during the day on Friday, so stay tuned to the updated forecast. Beyond all of this, it's windy and chilly Sunday, Monday, and Tuesday, and then a few flurries on Wednesday. Very cold on Thursday.
Okay, and that is the look at your weather for this upcoming weekend. So we could see snow this weekend. Very cool. First snowfall of the season. And now let's take a look at your COVID-19 updates. New Hampshire COVID updates. New information and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 22,332 number of people in New Hampshire have tested positive for COVID-19. 13,900,350 number of people in the United States have tested positive. 537 number of deaths from COVID-19 in New Hampshire. 842 number of people have been hospitalized with COVID-19 in New Hampshire, and 170 number of deaths from COVID-19 in the United States. Let's take a look at this map of New Hampshire where current cases of COVID-19 are. Manchester, 698. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester, 4174. Now let's take a look at these three checks here. Let's start with the first check here. New cases each day in New Hampshire in the purple. Daily new positive COVID-19 cases. In the orange, new hospitalization. In red, deaths. Let's take a look at this chart here. Current cases in the purple. Total current COVID-19 cases. In orange, current hospitalization. Let's take a look at this chart here. Total cases in the purple. Total positive COVID-19 cases. Orange, total hospitalization. Red, deaths. And blue, recovered. Let's take a look at this chart here. Positive PCR test rate and daily PCR test. And let's take a look at this chart here. Each group of cases, female and male cases, and risk information. Let's take a look at this chart here. Infections, hospitalizations, and deaths. Let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. A reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. And now let's get to your other news headlines. As New Hampshire announces 7 new deaths, Dr. Chan says data shows COVID-19 is much deadlier than the flu. Single-day record, 625 new cases announced yesterday. Let's take a listen to that video from WMUR News 9.
I joined Bellwether Community Credit Union 2 months ago. When we first got closed down, I was afraid.
Governor Chris Sununu says anywhere between 10 and 40,000 doses of COVID-19 vaccine will arrive in New Hampshire in the 3rd and 4th weeks of this month, and they will start being administered right away. He says the Pfizer vaccine will get here first, sometime after the 15th, and then the following week, doses of the Moderna vaccine will arrive.
We don't know exactly how much we're getting. We know it's, I'm going to guess, this is a strict guess, somewhere between 10 and 15,000 of Pfizer, somewhere in the 15 to 20 or maybe even 25,000 of Moderna. We're not 100% sure, but that's the ballpark range that we feel fairly confident. And that's really a nice range for us in terms of, that covers a lot of high-risk individuals.
Public health officials say there are around 100,000 people in the 1A phase of inoculation, and it will take a number of weeks before all of them have been vaccinated.
There is a prioritization even within 1A where we're going to target those high-risk health workers working in hospitals, then moving to ambulatory care settings and other settings as well, our home health care providers. So there's obviously a lot of people who work in healthcare, and we want to get to them. We also have the long-term care facility residents that we want to get to, as well as the first responders.
Meantime, public health officials are closely monitoring hospital capacity in the state. The governor says hospitals have freed up more beds since October, and right now, surge capacity is not needed. And the estimate for when the general population, that is people under 60 who are not at risk, will be getting the vaccine is sometime around March. Reporting live in Concord, Adam Sexton, WMUR News 9.
Okay, and there you go on that video and that report. 10,000 to 48,000 doses of COVID-19 vaccine from Pfizer and Moderna to arrive in the next few weeks, Governor Sununu says. Afterwards, vaccine to arrive on a weekly basis. Let's take a listen to that video from WMUR News 9.
Snow piles up quickly. Remove it just as quickly with Kubota subcompact and compact tractors. Our #1 selling.
This may come early for some on the front lines of the COVID fight. Governor Sununu expecting shipments of the COVID-19 vaccines to reach New Hampshire by mid-December.
You could be seeing anywhere between 10 and 40,000 doses of the vaccine here in New Hampshire within just the next few weeks.
Pfizer is the first vaccine expected to arrive, followed shortly after by Moderna. With the shipment dates quickly approaching, state health officials have been hard at work, constantly planning and tweaking the rollout. Dr. Elizabeth Talbot calling the distribution dynamic as well as considerate.
We really want this to be successful and for people to overcome any vaccine hesitancy.
Healthcare workers in hospitals and long-term care facilities, as well as patients considered high risk, will be some of the first to get the vaccines. The general population will likely not be able to start making appointments with their doctor until sometime in March. That's when Governor Sununu himself says he won't hesitate to roll up his sleeve.
I'm in the mix with probably the bulk of the general population, but when it's time to get vaccinated, I'm happy to be the first one up there.
But until then, a somber and pointed message to everyone living in New Hampshire. Now is not the time to let your guard down.
It won't be over when the vaccine arrives. It's not going to be over on January 1st, just because it's the new year. We still have a few months to go before I think the vaccine is fully implemented throughout the state.
And once the vaccine is available to the general public, it'll be similar to how you get your flu shot. You'll make an appointment with your doctor or you'll schedule an appointment at a clinic. Reporting in Manchester, I'm Nicole Lally, WMUR News Now.
Okay, and there you go on that video and that report. Health officials work to balance flu season alongside the COVID-19 surge. Testing guidance in place, health officials say. Let's take a listen to that video from WMUR News 9, Nicole Lally.
Fall home improvement season is taking off at Bell-Tate's Building Supply. From building materials to tools, paints, and everything else you need, we'll make fall home improvements a breeze. Shop online at belltates.com. Visit one of our 9 locations or place your order via phone or email.
Yeah, they're so similar, but if there's any positive news in healthcare to come out right now, it's that flu season is almost non-existent. Cases very low right now, when really we would be seeing an upswing here. That being said, doctors are still faced with questions when a patient comes in for COVID testing. The two illnesses we've heard for months now can be very similar. Dr. Ben Chan addressing this on today's weekly Health and Human Services virtual update. He says there is guidance in place and many people will get tested for both illnesses as a precaution. He says if you're testing for influenza, then of course you should be testing for COVID-19. If you go in though with COVID-19 symptoms, you should be tested for COVID-19 and then possibly influenza. It would be up to the doctor to make that decision. There are certain populations that would require, of course, both tests though. Dr. Chan says it's something that providers take case by case, and of course they're continuing to look at all of the guidance that comes out surrounding this. But again, the good news is those flu numbers are down. Reporting live in Manchester, I'm Nicole Lally, WMUR News Now.
Okay, and there you go on that video and that report. "21 veterans' death attributed to COVID-19 at New Hampshire Veterans Home in Tilton. Staff battling outbreak for 22 days. Let's take a listen to that video from WMUR News 9, Jennifer Crompton.
Snow piles up quickly. Remove it just as quickly with Kubota subcompact and compact tractors. Our number...
Staff at the New Hampshire Veterans Home in Tilton described as exhausted and sad, losing 6 more veterans to COVID-19 since Tuesday.
A really bad day yesterday. Really, really bad day. So we were up to 21 of our veterans have passed.
Able to keep COVID out for 8.5 months until the recent trajectory in community transmission.
We always knew it wasn't a matter if, it was going to be when. And November 10th was our win.
About 125 positive cases since then. Some residents have recovered, but there are still nearly 50 active cases and 40 active among staff. Long hours for everyone. The Commandant says they are doing everything they can to weather this crisis.
I wish I could say to you all the different heroes that I have here. They're not just the residents.
Staffing is an issue, but she says constant help and communication on the state and federal level is there, including 17 additional nursing staff from the VA system. The governor calling this a priority.
We have an infection team from the VA that has been on site in that facility, looking at exactly the hows and whys. Why is this outbreak a little worse than others? Again, the team has had anything that they need. They've had.
We reached out to the National Guard because I got maintenance guys that are out as well.
Veterans and their families actively choosing to stay.
Our veterans, they don't want to leave here. they understand that that's happening. They've made the choice knowing that they want to pass here. They want the care we provide to them. We're on day 22 of this battle, and we're going to get through this. And we're providing the very best care we can.
Jennifer Crompton, WMUR News 9.
Okay, and there you go on that video and that report. Goffstown Police Department issued a warning to the residents in Goffstown, New Hampshire. Let's take a look. Here's what they said on their Facebook page. Over the past few nights, we have been made aware of multiple vehicle break-ins occurring from Penardville in Bartlett area to Moose Club Park Road. For the most part, these vehicles have been left unlocked at night, and we are advising our residents to please lock up your vehicles to prevent further losses. Please keep these tips in mind regarding your vehicles. 1. Take your keys. Don't leave them in your vehicle. 2. Close all windows and lock all doors. 3. Never leave vulnerable items in your vehicle. Never leave credit cards, debit cards, cash, or your wallet or purse inside your vehicle overnight. 5. Park in well-lit, invisible areas, not hidden by foliage, or preferable inside a garage if possible. As always, if you see something, please say something. That is from the Goffstown Police Department. Judge, Town of Canaan must release report on officer related to arrest that left woman injured. As is evidenced by the National Conservation concerning policing in the United States, transparency at all levels of police conduct investigation is fundamentally important to ensure the public's confidence and trust in local police departments. And that does it for this morning edition of the Riley King Newscast, right here on the Riley King Network. Thank you for joining us for this morning edition. Have a great rest of your Friday, and I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.